Hello everybody, I'm Dr. Shreya Poddar and I will be talking about urticaria. So urticaria is also known as hives in common language. It is a condition in which you develop reddish, raised or maybe skin colored bumps on your skin that are extremely itchy. Now these lesions or hives as we call them last for a few hours, but the distressing part is that they keep on appearing, which is why it is a great source of concern for the patient. So urticaria is usually classified as acute or chronic. So if your urticaria lasts for less than 6 weeks, it is acute, and the reasons are usually because of a medicine that you might have taken. It could be post an episode of infection. It could be a bacterial infection, viral infection. It could be any seafood or any other food that you have consumed. And chronic urticaria is something when your symptoms persist longer than 6 weeks. And the causes are physical, like it could be triggered by sun exposure, intense physical activity, cold, even pressure, or it could be due to autoimmune causes or autoallergic causes. And sometimes we are not able to identify the cause and then we label it as idiopathic. So urticaria actually presents as very itchy, raised, erythematous or skin colored lesions on your skin, and if you see that these lesions disappear within a couple of hours but new lesions continue to keep appearing, then probably you are suffering from urticaria. Urticaria can also be associated with a condition called as angioedema, in which you get swelling of the eyes, lips, palms, soles. So basically there is fluid collection in the deeper tissues of the body. Now this swelling is usually more painful and lasts longer than urticaria. So urticaria is usually a clinical diagnosis. Often when patients come to us, they do not have any visible lesions on their body. So if you feel that you are having hives, always take a picture so that you can show to your dermatologist at the time of consultation. And the diagnosis is usually clinical, and sometimes we do a few blood tests to rule out other autoimmune or allergic causes. So urticaria is a fairly manageable condition. It can be treated with antihistamines, and for episodes that are severe and last longer, other prescription grade medications are given to the patient. And another important thing is to identify the trigger. If you're able to identify your trigger for urticaria, that particular trigger has to be avoided, and gentle skincare routine must be followed. So urticaria is a manageable condition. If you have urticaria which is acute, if your symptoms last less than 6 weeks, it's going to be well under control and usually does not tend to come back. But if your symptoms persist for more than 6 weeks, you might need long-term medication. But with prescription grade medications, it is manageable and you are going to be symptom free. If you are suffering from urticaria or any other clinical issue, please do reach out to me at Wizderm, Shakespeare Sarani or Jodhpur Park. Thank you.